Okay, so in our today's video, we're going to talk about the intracranial bleeding. Intracranial bleeding. Intracranial bleeding means bleeding inside our bones, our head bones. You know, our head bones are called cranium. So intracranial means inside our head bones. So any bleeding which happens around inside our central nervous system or around the central nervous system or inside our head bones, cranium, that is called intracranial bleeding. This is also called cerebral bleeding. Now, intracranial bleeding or cerebral bleeding, to explain this intracranial bleeding or cerebral bleeding, first of all, we have to understand the meninges. First of all, we have to understand the meninges. There are different layers around the central nervous system, and these different layers all together are called meninges. Now, actually this black diagram which I have drawn, this is called central nervous system. As you know that the central nervous system has many parts. Now this bigger part, above upper and most bigger part of the central nervous system, this is called cerebrum. This is called cerebrum. Now under the cerebrum, this part, this is called midbrain, right? This we can call cerebrum. C-E-R-E-B-R-U-M. Cerebrum, right? This we call cerebrum. Now under the cerebrum, there is midbrain. There is a midbrain. And then under the midbrain, we have pons. We have pons. And under the pons, we have medulla. M-E-D-U-L-L-A, medulla. And behind the midbrain, pons and medulla, actually midbrain, pons and medulla, all of them three together we call brain stem. And behind the brain stem, we have this cerebellum. C-E-R-E-B-E-L-L-U-M. Cerebellum. And under this, this part, under the brainstem and cerebellum, this is called spinal cord. So this is the part of our central nervous system that we have cerebrum, midbrain, pons, medulla, and behind we have cerebellum. And under this there is spinal cord. This is our central nervous system. Now around the central nervous system, we have three different layers. Now first layer, which is attached to the central nervous system, here I have shown with the dotted lines, very small dotted lines, and this first layer which is attached around the central nervous system, this layer is called pia mater. This layer is called pia mater. Now pia mater is the first layer which is present around the central nervous system. Now around the pia mater we have the second layer. This second layer which I have shown in the black diagram, black lines, outer black color, this is called arachnoid matter. This is called arachnoid matter. Now between the pia mater and arachnoid matter we have a little space, and this space is called subarachnoid space. This small space which is present around the pia mater and arachnoid matter, between the pia mater and arachnoid matter, this space is called subarachnoid space. Now, what is the function of the subarachnoid space? Subarachnoid space actually have CSF, cerebral spinal fluid. Now, cerebral spinal fluid present in the subarachnoid space. Now, outside to this arachnoid matter, I have shown this outer red color, another layer which is present around the central nervous system, and this outermost layer, this is called dura mater. This is called dura mater. D-U-R-A-M-A-T-T-E-R. Dura mater. Now, the first most layer is pia mater, second is arachnoid mater, and third layer is dura mater. And between the arachnoid matter and pia mater, we have subarachnoid space, which is having CSF, cerebrospinal fluid. Now all these three layers, pia mater, arachnoid matter, and dura mater, third one is dura mater. Now all these three layers collectively we call meninges. We call them meninges. So this is the little bit explanation about the meninges and central nervous system. Now we go to our topic. Now, to understand the intracranial bleeding, we can divide the intracranial bleeding into three parts. First part is epidural hemorrhage. Epidural hemorrhage. Actually, epidural hemorrhage is present between cranium and dura mater. So this is outside the meninges. This epidural hemorrhage, which is called epidural, epidural hemorrhage. This first type of hemorrhage is present between cranium and dura mater. So it means it is around the meninges. It is outside the meninges. So this is present around the outside the central nervous system. Now, what causes epidural hemorrhage? Now, to understand the cause of the epidural hemorrhage, the main and the most important cause of epidural hemorrhage is trauma, right? Trauma, we also call brain injury. For example, the patient got the roadside accident, and in the roadside accident, he got the head injury. And because of the head injury, the arteries which are present inside the cranium, these arteries are destroyed, these arteries get ruptured, and because of the rupture, patient gets accumulation of blood around the you can say dura mater and under the cranium. So this is called epidural hemorrhage, and the trauma causes epidural hemorrhage. Now, how we can find that the patient have the epidural hemorrhage? The characteristics of the epidural hemorrhage is that this patient have the lucid interval. Now, this is very, very important to understand what is lucid. L-U-C-I-D, lucid, I-N-T-E-R-V-A-L, interval, lucid interval. Now, what is lucid interval? Okay, for example, the patient got the brain injury, right? The patient got the brain injury, and after the brain injury, patient become unconscious for a few seconds. After a few seconds, patient wake up and he become conscious. And after patient wake up and become conscious, after that the patient is losing his consciousness slowly and slowly, gradually over the days, week and month. This is called lucid interval. What is lucid interval? Actually, lucid interval, you can say the interval between two unconscious levels. Patient got the injury and he became unconscious for a few seconds or few minutes, and he become again conscious. And after that, the patient becomes slowly loses consciousness over the hours, days and weeks. The patient got the loses consciousness. This interval, when the patient got the first unconsciousness, then became conscious, and then the second unconscious level, this interval is called lucid interval. So you can say the lucid interval is the interval when the patient loses his consciousness over the days, hours and weeks. This is called lucid interval. Second thing which the second and the most important characteristics of the epidural hemorrhage is that if you do the CT scan of this patient, that inside the CT scan, this hematoma looks like lens shape. This hematoma looks like lens shape. Okay, here I have drawn, for example, this is outermost is cranium. This is cranium. Cranium, you know, the bone of skull. Cranium. And then this one, we can see that this is, let's suppose we can say this is dura mater. Dura mater. Now you can see that there is blood between the dura mater and the cranium. And this bleeding looks like lens. Looks like a lens. So what really happens that when you do the CT scan, of this patient, inside the CT scan result, we can see that the patient have the lens shape appearance. And we can say the characteristics, this is the very, very characteristically finding of the patient of the epidural hemorrhage, that they have the lens shape hematoma inside the CT scan result. So this is first type. The second type of intracranial hemorrhage is subdural hematoma. Subdural hematoma. Sub means under, dural means dura mater. So this is the hematoma or hemorrhage which is present under the dura mater. So this is present between the dura mater and arachnoid mater. So there is a dura mater and the arachnoid mater. So under between these two, dura and arachnoid. Now what causes this subdural hematoma? Actually, subdural hematoma is caused by the decelerating injuries. Decelerating injuries. What are decelerating injuries? Actually, what really happens that, for example, the patient is going into the car, right? And because of some reason, patient suddenly brake the car, stop the car. Now what really happens? That when the patient stopped the car, right, he stopped his body movement, but actually his brain is moving with the same speed. When the brain is moving with the same speed, what will happen when the patient stops the car? The brain goes ahead, right? But our cranium is fixed, right? What will happen? That our brain is floating inside our cranium, right? What will happen? That when the patient is going into the car and he suddenly stops the car, brake the car, what will happen? That our body is moving with the car and our brain is also moving with the car. But when the patient stops the car, right, body stops, but brain is moving. And the brain is moving, right? There is decelerating injury between the cranium and the brains. So what will happen at this time? The veins which are attached between the cranium and brain, these veins are ruptured. These veins are ruptured. For example, here you can see I have drawn that these are the veins. These are the veins which bring the blood, venous blood, from the brain to the this space to the subdural space, in the dural space, right? Dural space. Now what will happen that these veins which bring the venous blood from the inside of the brain to the outside of the brain, these veins are called bridging veins. These veins are called bridging veins. Now what really happens that when the patient is moving, right, and he suddenly stops the car, so our brain wants to move ahead, but the cranium is fixed. So these veins get ruptured. So due to the bridging of these veins get ruptured, and there is this kind of injury is called decelerating injury. This kind of called decelerating. Decelerating means stopping the car or stopping the movement. Decelerating injury. Now what kind of patient can have this kind of injury? For example, what kind of patient have the decelerating injury? First of all, alcoholic patient. For example, the patient drink the alcohol, right, and he don't know how to move, right? So he move here and there. So this kind of injury happen in this alcoholic patient. Or epileptic patient. Some patient have epilepsy, right? Some patient may have the epilepsy. So this epileptic patient may have this kind of decelerating injury. Or there are elder patient, that the people who are very old, and when they move or when they fall down, they can have this kind of decelerating injury. Or the people who take the anticoagulant drugs. Anticoagulant drugs means that these are the drugs which are given to the patient, like aspirin. These kind of drugs are given to the heart failure, the patient of the heart, like the patient has a coronary heart disease, or the patient who has a stent. These kind of patients, or the patient who have some kind of other problem, they are given NSAIDs, right? Anticoagulant drugs, for example, NSAIDs, right? Or warfarin. So if the patients are giving the NSAIDs or warfarin, all of these are called anticoagulant drugs, and they make the blood very, very thin. So these patients also have the chances to get the subdural hematoma. Now, once the patient, due to these causes, patient get the subdural hematoma, what are the characteristics of these patients? The most important characteristic is that if you take the CT scan of this patient, in the CT scan, their hematoma looks like crescent shape. Their hematoma looks like C-R-E-S-C-E-N-T, crescent shape. Crescent shape means moon shape, right? Half moon shape or first base moon shape. So here you can see that due to these bridging veins, and the patient may get the injury, this patient may have this crescent shape. Under the CT scan, this patient may have the crescent shape CT scan findings. Another thing is that these patients have the fluctuating levels of consciousness, that their consciousness level increases and decreases. So they have the fluctuating levels of consciousness. So these was all about the subdural hematoma. Another third most important type of the intracranial bleeding is subarachnoid hemorrhage. Subarachnoid hemorrhage. Now this hemorrhage is between arachnoid matter and pia mater. This hemorrhage is between arachnoid matter and pia mater. And if you remember, first in the beginning of the video I have told you that between arachnoid matter and pia mater there is space called subarachnoid space. So this, when the patient gets the subarachnoid hemorrhage, the blood goes into the subarachnoid space. Now what causes this kind of subarachnoid hemorrhage injury? First of all, the first and most important is aneurysm. Aneurysm. A-N-E-U-R-Y-S-M. Aneurysm. Now what is aneurysm? For example, this is one artery. This is, let's suppose we take any artery inside our central nervous system or around our central nervous system. Now what really happens that, for example, this artery when the problem happens that and the wall of the artery dilate, artery become like this, right? When the arteries, then the wall of the artery, there is abnormal dilation of the wall of the artery. This is called aneurysm. A-N-E-U-R-Y-S-M. Aneurysm. And there are high chances that this area may break. There are high chances that this area may break and the blood may go out. Blood may go out. So the first and most important cause of the subarachnoid hemorrhage is aneurysm. What is aneurysm? Abnormal dilation of the arteries. The second cause of the subarachnoid hemorrhage is arteriovenous malformation. Arteriovenous malformation, and this is not very common. This is called arteriovenous malformation. Now, once the patient gets the subarachnoid hemorrhage, what are the characteristics? What are the characteristics? Now, the characteristics of these patients is that first of all, that these patients have the headache. These patients have the severe type of headache. We also call thunderclap headache. Severe headache, or we also call thunderclap headache. Thunderclap means that, for example, when there is a raining, and during the raining there are some sounds coming from the clouds. There is a heavy lightning, and it makes thunder, very strange type of sounds. And these kind of sounds are called thunderclap. Thunderclap. So the patient may feel the very severe type of headache. That is called thunderclap headache or the simple severe headache. Also, the patient may have the vomiting. Right? The patient may have the vomiting. Why the patient may have the vomiting? Because the pressure in the cranium increase. So we can say that all these symptoms, the patient have all these symptoms because of the increased intracranial pressure. Intracranial pressure. So we can say that the patient have this headache, vomiting, or decreased level of consciousness, or sometimes seizures. And all these symptoms are due to increased intracranial pressure. So these are the different types of intracranial bleeding. Now, the last type of the intracranial bleeding is intracerebral hemorrhage. Intracerebral hemorrhage. That this is the hemorrhage inside the central nervous system. This is the hemorrhage inside the central nervous system. If you remember that we have seen that this epidural hemorrhage or subdural hemorrhage or subarachnoid hemorrhage, these hemorrhages are around the central nervous system. These are around the central nervous system. But this hemorrhage, intracerebral, intra means inside, cerebral means cerebrum. So this is the hemorrhage which is inside the central nervous system. So that's why we call it intra, I-N-T-R-A, intra, C-E-R-E-B-R-A-S, cerebral hemorrhage. This intracerebral hemorrhage is present inside the central nervous system, and it is also very common and very dangerous type of hemorrhage. What are the causes? The most important cause for this intracerebral hemorrhage is hypertension, right? So when the patient who have the severe hypertension, uncontrolled hypertension, means they don't take any medicine or they don't control their hypertension, they can have the intracerebral hemorrhage. And the most important, they have the neurological deficit. Sign and symptoms are neurological deficit. Neurological deficit means that they have loss of neurological functions. They can have the many symptoms depending upon the location of the hemorrhage. So these have the neurological deficit. Neurological deficit means loss of neurological functions. So this is also very dangerous type and very common type of intracerebral hemorrhage. But altogether we have the intracranial bleedings. We have all these, mainly these 4 types of intracranial bleeding. Thank you very much.